Hello, this is Dr. Manus Chakraborty. We'll be talking about cervical cancer in a nutshell. We will be discussing about the symptoms, causes, prevention, treatment, and few other interesting aspects of it. So let's start with the symptoms. So when do we suspect cervical cancer? Cervical cancer symptoms are mostly vaginal discharges, irregular vaginal bleeding, blood-mixed vaginal discharges, which is not going away with conventional treatment. Bleeding after intercourse could be a sign of cervical cancer. Of course, not in all the cases. Any bleeding after menopause or irregular bleeding after 35 to 40 years of age needs to be investigated for these types of problems. Sometimes cervical cancer comes with urinary problem or potty passage problem or weight loss or just generally feeling unwell, or even it sometimes presents with kidney failure. Causes. What could be the causes of cervical cancer? The overwhelming majority of cervical cancers are linked with a virus, which is known as human papillomavirus. There has been buckets of researches funded by WHO and various other foundations, which showed that the cervical cancer develops over 5 to 15 years' time when a person or woman gets infected with HPV or human papillomavirus. HPV or human papillomavirus is very common. It is thought that every 3 out of 4 women and men have got HPV in their body. And of course, it is a sexually transmitted disease. Usually, HPV gets transmitted during first few intercourses. And most of the cases, body can fight off the HPV infection. However, in some cases, HPV stays within the cervix. It could be a problem with the immunity, or it could be other problems. That is not very sure to the science. However, in the persistent HPV infection cases, the cervix changes from normal to precancer to cancer. This journey takes about between 5 to 15 years. As this is a sexually transmitted infection, early age of sexual intercourse or multiple sexual partners increases the risk of cervical cancer. Smoking or long-term steroid uses, which are likely to reduce the body's immunity, can be a contributing factor as well. As regular pap smear detects precancer very effectively, not having regular pap smear can be an indirect cause of cervical cancer. Investigation. On suspicion, the cervix needs to be evaluated. It can be evaluated on naked eye with the vaginal examination, or sometimes we need a bright light and magnification with some special lenses known as colposcopy. These are not a surgery. This can be done as an outpatient basis. Sometimes a small pinch of tissue from the cervix needs to be taken to be checked under microscope via biopsy test to check if there is a cervical cancer or to rule out cervical cancer. If cervical cancer is proven, in those circumstances, MRI scan, CT scan, or even sometimes PET CT scan is required to check the progress of the disease so that the next step of treatment could be ascertained. Treatment. In India, most cervical cancers, when they get detected via symptom-based pathway, they are not suitable for surgery anymore. And many of them stay incurable. However, there are treatments available, and these treatments are known as chemoradiation. No, this is not chemotherapy, not radiation either. So it's a combination of chemotherapy and radiation. The mainstay of the main treatment is via radiation, which is by giving a light or radioactive ray onto the abdomen, and some radioactivities given through the vagina in a very friendly way. Weekly chemo is given to enhance the fight against cervical cancer so that the radiation becomes more effective. And this new variety of treatment is known as chemoradiation. The whole therapy takes between 6 to 8 weeks, and sometimes a little bit longer if there is more chemotherapy is needed. But this is in a nutshell the treatment. However, nowadays women are getting more cautious. They are doing pap smear and they are coming to doctor earlier than previously thought. In these early cases, cervical cancer can be very well managed with a radical surgery or radical hysterectomy. This involves removal of the uterus and few other glands around the uterus. If the cervical cancer or the precancer is detected at a very early stage, then even hysterectomy is not needed. Removal of the uterus will not be even needed. There, the slice of the abnormal cells of the cervix are removed with hot wire, of course with a lot of anesthesia and stuff, so that the patient remains comfortable. Just a slice of tissue from the cervix is removed, and that cures a patient. So therefore, it is important to understand the need for pap smear, and to understand the pap smear is very important tool in the cervical cancer battle. And the pap smear is done in healthy women, not when the symptoms are knocking at the door. In those circumstances, pap smear will not be an important weapon against cervical cancer. If the symptoms have already started, in those circumstances, taking a biopsy from the cervix will be more prudent than just relying on pap smear. Prevention. Cervical cancer prevention is a big chapter, because nowadays we have got vaccines against HPV, and India's indigenous HPV vaccine is in the process. And if you want to know about that in detail, we have got a link in the video of our YouTube channel. I will link it somewhere in the description. You can have a look at that video. Every girl should get HPV vaccination at an early stage. In some countries, it is given between 8 to 9 years of age. But if it is given in 13, 14 or even 15 years of age, it is good enough. Usually, the vaccine is recommended before the first sexual intercourse. Even if the sexual intercourse have started, even then women can take the vaccinations. However, they will not be as effective as given to the girls. If you not had the scope of having the vaccine, then regular pap smear can still save you from developing cervical cancer in most of the cases. Even if someone has received the vaccine, in those girls, when they become women, they could also have a pap smear just to be doubly sure. So that's all today about cervical cancer. This was, of course, a small take from a very big chapter. If you want to know more about the cervical cancer, feel free to comment down below. We'll be happy to answer that. Till then, have a good day and take care.